Good morning, good morning, good morning. Dopest mornings. We in this thing. Let me see. Boom, 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 boom. Mm-mm. All right, we back. Let's get at it. I was having some internet issues. I didn't want it to you know what I'm saying? So I just figured I'd get it right. Mm-mm. Mm-hmm. I see we got 3 people in there. Good morning, good morning. MR. Who's that? Good morning. Welcome. We talking about COVID and people of color. You know what I mean? I think a lot of I don't know. I think it's real. Hey, good morning. Good morning, Brittany. Oh, Jazzy, what's poppin'? Hey, good morning. Yeah, good morning. Yeah, they gonna say it's gonna be a bigger outbreak. Well, I mean that's right around the corner. Cause they say in the fall, shortly after flu season. You from Tag? Okay, okay. Well, I appreciate you coming to Dopest mornings. Get you some coffee. Get you some coffee. Oh, it's Brittany, bitch. Okay, yeah, yeah, yeah. Make sure you guys, yeah, that's what's up. I'll remember that. Um, Make sure you guys share this broadcast for me. Share it to Facebook, Instagram, to I don't know. Share it to somebody. Text message them. We gotta get this thing rocking and rolling. I want to know what y'all think about this COVID and mm, I don't know. I've been, to be honest, me myself, I've been preparing. I've been preparing for if it's gonna be another outbreak. I want to be prepared. I mean, like it's a. I don't even want how you could say it's an outbreak because another outbreak because it's still breaking out. I'm terrified of it because it's one of those things that you can't help it. It's nothing that you could do even if you follow all the right steps. You know what I mean? Even if you follow all the right steps, it's nothing that you really could do because you relying upon other people, right? Man, everybody tell. I probably. I mean, I went and did a video shoot. I got you. I think COVID is scary. I don't know what to believe. I heard so many different stories. Well, as with anything else, I think the COVID is gonna affect poor people and primarily people of color more than anybody. And you got the you got the numbers and the research to bear the truth. You know what I'm saying? So let me see. I was doing some reading yesterday, last night, and one of the things that uh, helps, or I want to say hinders, minority communities. I'm not sending my kids to school. Is like a lot of minorities are on Medicare, whatever your state has. We have Medicaid, I think. I don't even know if that's still around, but Medicare is made, I believe, to where you can't. Most people don't have a primary physician when they're under Medicare. So, um, with that being said, let me go ahead and get this out here. It says counties with a population above 85% had a death rate up to 10 times higher. That's crazy. That's crazy. 10 times? And then, most places where minorities live are densely populated. You know what I mean? Just keep it real. In the barrio, you just, hmm, yeah, I'm finding one that's hard, it's scary. Yeah, when you got people, they live in projects, you know, a lot of communities have projects around the country. Those people, they live in close proximity to each other. You know what I mean? And a lot of ethnic people of color, uh, we live close, you know. Hispanics, they congregate, a lot more family wise and friend wise. They don't care about they getting together. I was reading something on the Mexican, they antidote. They antidote for they got a little concoction that they put together. Who control them numbers? I don't know. That's the thing, and this kind of why I want to talk about that. Hey, Rare Breed. Good morning. Good morning, everybody. I wanted to talk about like that part. Is it because us as blacks or Latinos or whatever ethnic background, uh, we're just mistrusting the information that comes from the man. You know what I'm saying? I just feel like we just mistrusting the information that they give us. Cause when I went out, man, I saw everybody, a lot of people with masks on and stuff like that. Except for to keep it real, I saw a lot of blacks when I was out doing a video shoot last week. I saw a lot of blacks and Latinos that they didn't give two. I saw a lot of people in general, but in certain areas where mostly everybody had masks on, I didn't see. I feel they trying to erase people off the map. You think it's the government? Well, I mean, it's to me both. Even if it is the government's doing, if it's not, then the incompetence of our leadership, you know what I'm saying? He's not my president. His leadership and him not taking it serious. If you don't have it, if it's not being taken serious from the man that they got all the whole deck of cards, then what we gonna do? Queen Dopest in the building. It is a government thing. So with that being said, is it? We dealing with science. We dealing with science. Is it just a because I was watching on the, CNN last night. They were saying that um, basically the White House wants us to just learn learn to live with COVID. You know, basically the White House wants us to live with COVID and just like kind of get used to it. Let me check this out real quick. Okay, back to what I was saying earlier. People with Medicaid or high deductible plans are less likely to have a primary care physician. 34% of black people and 15% of white individuals are covered by Medicaid and therefore less likely than people with employer sponsored insurance to have a regular physician. So, what that's saying is people who don't have a relationship with a primary care physician were much less likely to get tested. And I was reading something on the locations of these testing centers. You got to read up on that. The location of these testing centers. Somebody shared this to Treasure. Hold on, let me see. Okay, there we go. Hopefully she got that. You know what else ain't in here? Kisa. All right. Yeah, so and then they say that black people, we already have a lot of high risk factors because we have more people with cases of diabetes and high blood pressure, and those are high risk factors when it in terms of COVID-19. This the time to eat healthy and live healthy. But that's what I said. If this is what it is, look. The craziest part is that people like if I put my mask on, that mask isn't protecting me from you. You know what I'm saying? That mask isn't protecting me from the next person. 5G got. I gotta see. Look, then it's you trust in the where all these numbers coming from. Who's trusting all these numbers? You know what I mean? Like all these numbers and all this stuff. It's either you're gonna get sick. Like I said, the White House, their position pretty much is fuck COVID. There you go. All in one. What's good? Good morning. I got a lot of my One Love family in here. I got Queen Dopest, Rare Breed, Jazzy, Bella in here somewhere. She trying to figure out how to hit the chat. I'm not sure. I see. It's right at the bottom. We got this Britney bitch in here. That's Treasure, y'all. Girlfriend. Hmm. That's crazy. Oh man, I don't know. I mean, like I said, it's tough. Cause I mean, people are getting sick, you know. But like I said, from what I seen, the White House and the quote unquote leadership, um, they pretty much expect us to just have to live. They like we just gonna have to live with it. So that means tens of thousands of people gonna be dying, and I don't know. It's wild. Hmm. Mm. Anyway, it's crazy out here. I mean, they locking stuff up. They locking us. It's gonna be worse. I mean, at some point, if things continue at this pace, we gonna be on another severe lockdown. And if we don't, it's basically like we don't give a fuck. But because you can't ignore hospitals full of people, like a lot of people survive, especially like I say, people of color. We have a real mistrust of government, uh, information. They've been holding my man. Yeah, it's all kind of it's your mail. It's I admire everything that you do. I I appreciate it. I just enjoy being amongst people, man. I enjoy being amongst y'all. Especially with doing this, I get to find out what y'all think without no limitations and restrictions, you know what I'm saying? It's like fuck it, balls to the wall. Let's put it on the table, raw, uncut. You know what I mean? So that's the main reason I'm here on YouTube. It's because we can say what the fuck we want to say. I ain't worried about getting banned. Matter of fact, let me light something up real quick and keep this thing going. But no, the numbers, yeah, that's how it needs to be. I want to reach a broader audience, pretty much is why I'm here on YouTube. But yeah, it's been bothering me. Everybody knows me, man. For like the first 3 months or whatever it's been, I only left the house. Um, you have to try a different device. It's throwing me off. Boom, boom. Look at these numbers again. Okay. Trying to look up this information, y'all. My bad. So it's a lot of determining factors. Your health, obviously, if you have underlying health issues that make you high risk, access to care is another. Access to testing. They found out that the testing kits were in less availability in poorer areas as they were in more affluent neighborhoods and areas, and that's where most of the testing centers, from what I read, are at, or not so much in the poor neighborhoods. You know what I'm saying? I think I was watching Atlanta's mayor. She contracted corona, and she was talking about just how it was gonna be to be a mom. You know what I mean? My aunt that I'm named after, my auntie Andrea, she she got COVID. You know what I mean? She got it early on. She thought it was a flu, was still going out amongst people, and it's no telling how many people that she spread it to. I just know most black people I know, it's 50-50. I got some that feel like me, and they like, I'm staying my ass in the house. And then I got the other half that's like, you know, I can't live in fear. I'm going to do my thing regardless. So it's kind of like 50-50 from what I've seen. I got a real late start today on all kind of levels. So I had to scramble up in here and get this thing rolling. Yeah, I'm fortunate though. I know it's a lot of people that they don't really have a choice. You know what I mean? They gonna have to go to work regardless. They work is gonna put them at risk. Um, Even if, like I said, if you in a place and half the people got masks on, your mask don't, it doesn't do you any good. Because the mask isn't to protect you. The mask is to protect others. So when you don't see anybody with a mask, are you to feel like they don't give a fuck about you? I'm curious about that. I'm curious about that, my people. So yeah, like I said, you could take all the precautions, but if the people around you, it's one of them things where it's not on you. It's not 100% on you. It's on the people around you. the places that you frequent, yeah, I'm gonna vote. I'm voting Biden. I'd vote for a cockroach before I voted for I vote for a cockroach before I vote for anything else. I mean, Bernie ain't in it. Shout out to Bernie. Shout out to Bernie. I mean, even look, the vote is important, but as we saw, even when Obama was in the chair and was president, it's so much more to it, man. It's so much more to it. You know what I mean? I think everything go back to the same thing. It's kind of go back to what we was talking about yesterday. You know what I mean? Kind of goes back to what we was talking about yesterday. As far as our infrastructure. I mean, we in such a place of lack of everything, lack of information, lack of resources, lack of uh, access to get the information and the resources. You know what I'm saying? I mean, everybody is not you. So like, if you thinking about all these things because you in tune to the news and what's going on around you, everybody not like that. So they out doing what they doing with no knowledge. It's not that they ain't heard about it or know about it. It's just like, what can they do about it? Because like I said, if you don't have a car and you got to go to work, if you don't have a car and you got to go to work, what's your options? Public transportation. So if you take public transportation and you still wear a mask, but there's people on the bus without a mask or not wearing a mask properly, or you gotta hold a pole, or you gotta, I mean, it's and you accidentally, I mean, there's so many kids. There's just no protection from it, really, to me, because everybody ain't wearing a mask. Everybody's not quarantining. I believe if back in February or January, the if he's not my president would have shut everything down all at once, it would have made a drastic difference. But when you got every state deciding and choosing, every county, every city, every place decide making their own decisions when it comes to um, what type of restrictions are in place for the public, then you got an issue. We're not coordinated. I understand how one state could be doing one thing and another state right next to it is doing something totally different, and you think people from that state not gonna infect people in the state next to them? People don't travel. That's how this fucking disease got everywhere anyway. You know what I'm saying? Because people move around. People touch shit. People visit people. I think everybody do need to get out and vote. You know what I mean? Sometimes I feel like we just picking the lesser of two evils. It don't matter who. Once they get in that spot, they got to jump through so much bureaucracy and red tape. It's hard for anybody, even if they did have a great agenda and things. Yeah, because the disenfranchised and disadvantaged people always gonna have a hard time being heard. It takes drastic measures to be heard. And right now, it's a whole nother fight going on for certain segments of the population to even be treated as humans. You know what I mean? I think even with this COVID thing, we being treated less than human. You know what I mean? I mean everybody, because it's not being taken serious. You know, the White House has been talking more about what's the name, Bubba Wallace and the noose. Yeah, hey, Boss Bella is in the building. Hey, Bella. Um, yeah, jump in on the conversation. I only see 2 thumbs up. It's 5 people in here. It should be 5 thumbs up. Click the thumbs up button, please. The more y'all comment, the more that you guys interact, the more visible the live stream is on the YouTube. Yeah, so make sure you guys also go check us out at onelovefam.com. That's the number 1, lovefam.com. If I'm not subscribed to your YouTube, make sure you comment once this video is uploaded so I can go and follow your YouTube. Because like I said yesterday, it's all about free love, us spreading this around, building our numbers up. It's a numbers game. Everything is a numbers game. But I still am very scared of Corona. Yeah. I ain't gonna lie. I don't believe it's made up. It's like this ain't the first outbreak. This ain't the first disease. I don't know how it got here. Um, I'm sure, like everything else, there's tons of shit that we don't know as a general public about where it came from. Okay, it came from China, they say. Was it in a lab? Was it through what was this, what they call it, a wet market, or the flea market, or whatever the case is? I don't know. You know what I'm saying? Um, but the numbers is the numbers. Okay. The numbers is the numbers. Oh, let me switch the music to this other speaker, y'all. I know someone who has it. Um, it's Trey. It's in our One Love family. I think Trey lost two people in his family already to COVID. Yeah, he lost 2 people already.
Connected to iPhone and iPad.
Mm,
iPad disconnected.
mm. Like I said, my auntie has it, but I ain't been around her, so I mean, I really don't. She recovered from it. I mean, that's the thing. A lot of people that have gotten it have recovered. They don't talk about those numbers as much. They don't talk about those numbers nearly as much, but it's basically gonna wipe out. If things continue how it is, it's gonna wipe out everybody that has underlying health issues. It's gonna wipe out everybody that has any old people that get it. That I mean, cause let's keep it real. When you get older, you start, you know, acquiring, for lack of a better word, different medical and health issues. You know what I mean? It could be hereditary. It could be a lot of things.
Connected to iPhone and iPad 3.
There we go. Now it's working. Or is it? Mm-mm-mm.
Connected to iPhone and iPad 3.
I don't know. I ain't
iPad
got
3
time.
disconnected.
I ain't got time for it. All right. I know. So only one person in this room knows somebody that has it. So only one person in the stream knows somebody that has it. Wow. Cause I only know one person. Um. See, Joy. She. Her uncles. Did they recover? Yeah. Oh, I did. They recovered. Oh, they did. Okay. Yeah. I mean, a lot of people had it and don't even know they had it. You know what I mean? Because I'm telling you, back in January, man, I was gravely sick. I don't even get sick. And, yeah, I know somebody that's in the healthcare field, head nurse at St. Joe's here in California, that they said you might have had a strain of it. I mean, because you're going to get different degrees of it after they quarantined alone. Yeah, yeah. That's the whole thing, though. You can get it, and if it's just like the flu, and I mean, you can get it just like the flu, and you not know. I mean, you could. It'd be very easy to pass away from that and not know. So then you got people like me. I think if I had the sniffles for too many days, I'm headed in to find out what's going on. I'm headed in to find out what's going on. You know what I'm saying? I mean, to me, that's the biggest issue, only issue in life right now. You know, it's even hard to, like I said, the not last weekend, previous weekend, I was out amongst protesters and all that. It's like even the protests, it's like everybody think they being smart, but are we really playing right into their game? Do they want us in large packs? Mm. Because they also say that it takes more people to get it for them to be able to find a cure. So all everybody's got these conspiracy theories about it's the government. Man, well, you think the government don't want you out there protesting then? You know what I'm saying? You think the government don't want you out there protesting? If it's them? Hell to the yeah. Hey, K, one love fam. I see you, bro. Make sure you guys hit them thumbs up. I see 2 thumbs up on the stream. Share it to your folks for me, please, and thank you. Welcome to Dopest Mornings. We doing it easy. You know, coffee. If you ain't got to work, roll up some, Put some Kahlua in your coffee. I don't know. AK, we talking about COVID and colored people and people of color. I mean, because I see a lot of people that's in here that, to be quite honest with you, you got some people in the stream right now that some of them go out. Some of them are forced to go out to work. Some of them have parents that are elderly and high risk. Some people have mates that are high risk. I think my oh, that's dope. Well, welcome. I ain't gonna lie to y'all. I'm anxious to get to like fall and winter, cause I want to see what it's gonna be. I want to see what it's gonna be. Yeah. My main concern is I'm scared not that I get it. I'm just so scared to give it to someone I love. That's a huge thing. 'Cause I don't want to give it to someone I care about. You know. I mean, that's a tough way to die though. Because if you get sick, I mean, you can't have nobody around you. Oh, Florida's out of control. Florida's out of control. Yeah, Florida's numbers are crazy. Like crazy. I just they opened back up the beaches. I mean, if anywhere you gonna be, you know what I mean? I'm gonna be honest, if you're gonna open up anything, it might as well be the beaches. I mean, that's the closest thing. They talking about opening up everything, all this other stuff. The beach and you outdoors, but ain't nobody practicing social distancing at no beach. They definitely not gonna practice no social distancing at no bar. For black folks have a barbecue. Cause look, I'm guilty of it, man. I did that video shoot. Man, I swore I was gonna go up to the video shoot. I was gonna stay the hell away from people. I was gonna put my mask on. You know what I mean? I ain't do none of that. We got 3 thumbs up, man. Make sure everybody hit that thumbs up. Share it for me. I swear, as soon as I saw the homie, and no, first I saw my homegirl, Tammy. Tammy walked up to me and she just hugged me. What was I gonna say? Nah, get the, this is my friend years. You know what I'm saying? It's like I couldn't not hug her. Then I start seeing the homies pop up. Oh, what's up, man? Yeah, that's real. That's real though. How can you not? And I think I was talking to somebody about that, and I think it was counting how many people I was hugging it. I saw you hug this person. I saw. Then the craziest thing is my mask broke. Hey, what's up, Trey? And the crazier thing is my mask broke. We got Trey is the dopest. One Love is in the building. I got a lot of my One Loves in here, man. Make sure you share it to your Facebook or your Instagram. Shout out to my One Love family. Yo, Trey. Oh. It's a good thing Trey is in here. Because Trey, we talking about COVID. And out of everybody I know, unfortunately, bro, I love you, man. You've been affected by COVID more than anybody I know. Man, my boy Trey done had a tough 2020. Y'all make sure y'all say prayers for my boy and everybody else that's been affected by this fucked up disease. But yeah, man, when I first met Trey, I remember when I first met him in my live stream, I went and checked his out. And he was dealing with loss, man, from the first day I met the brother from COVID-19. So if you want to, some people say it ain't real. There's a man right there. I think he lost 2 family members. God bless him, man. May they rest in power, man. But yeah, Trayden lost, I think, 2 family members to COVID. So it's definitely real. It's definitely real. And I think the fucked up part about it, you could say it's you, but if you get sick from COVID and you pass away, that shit is gonna affect your family members in the most fucked up way because they couldn't be there for you. I remember when Queen Dopest mom was in the hospital, and I don't think they wouldn't let her, like, this is when the first lockdown and all that shit started. And Queen Dopest couldn't see her mom. That was the most fucking heart-wrenching thing. I mean, that shit was killer. Fortunately, God bless her that her mom, got better. She didn't have COVID, but she was in the hospital at that time where it's like you couldn't even get in the fucking hospital unless you was the sick person. You know what I'm saying? But yeah. I mean, that's a fucked up way to go. I mean, we all gotta go, but most of us want to go surrounded by family. I made sure I bought more masks, and due to them numbers increasing, I closed all windows and bought. I mean, that's all you could do. But the fucking masks don't help. I'm gonna keep it real. Out of everything that, and it's his fucking fault, because I'm pretty sure he can put down an order for us all to mandatorily wear masks. You know what I'm saying? But the mask ain't gonna protect you. The mask does not protect the person that's wearing it. It is used to protect others from your droplets. But unless you're wearing goggles, glasses, you're still not protected. I mean, you can have on an H95. or whatever, H90, whatever. I got one in the house. Man, that thing is so fucking, you can't wear that shit. Man, God bless the people that work in the healthcare. Cause I wore my H whatever to the store. And I had that shit on all of a few minutes. And it was so difficult to communicate, talk, breathe, any of that. Any of that. So if the people around you aren't wearing masks or they're not wearing masks correctly, you know what I mean? Because say I see people with the mask on and they got their mouth covered, but sometimes they pull it down and their nose is sticking out. I don't know. You know what I mean? I really, truly don't know or see unless it's a mandatory 14. It at least have to be 14 days. And that'd be nationwide lockdown. That means to where if they say right now, you guys got a week to go get. Nah, that should have cost pandemonium. Never mind. Oh my God, I wouldn't even. Because you see how people was over the toilet tissue and all that shit. I remember I was talking to Bella. Bella had to go to 5 stores to get some toilet tissue. She had to go to 5 different stores. I've been fortunate. I ain't had that issue. Nothing like that. But those are real issues. And I've been telling all my One Love family, friends, affiliates, associates, and others to prepare now. Because if they telling you, now check it out, I'm going to say it again. If they telling you it's going to be worse, no one was wearing a mask. Right. Man, imagine, because, you know, I partake in medical marijuana, 420, you know, um, straight out the stores, legally here in California. What about motherfuckers that smoke weed together? Unless you smoking some Reggie. Unless you smoking some Reggie. Y'all gonna be coughing. Man, they say if you cough or sneeze, okay, 6 feet is good if you're not doing nothing. But if you cough, sneeze, or any of them things, I think that shit goes between uh 15 and 30 some odd feet or something. What? And I don't know how long that shit linger in the air, and I don't even know if they know. I don't even know if they know how long that shit linger in the air, and you know what I mean? We we in a tough time. I know that, but you know, gotta keep living. I just feel like they dropped the ball, and like a lot of y'all in here saying, it may have been purposeful, that they did how they did. Oh, we're gonna just, let the states and this, that, and the other. Instead, it should have, these other countries, it wasn't up to the certain provinces and cities and motherfuckers in Malaysia and Singapore and all that shit. And they said everybody stay home, everybody was home. We the only country. Ain't that crazy? We are the only country where the president is like whatever, or the leader or whatever is like, we'll just deal with it. You got our own fucking commander in chief will not wear a mask. He wants to have gatherings of hundreds of thousands, and they're not required to wear a mask or practice social distancing. I don't understand it. And again, that's fine because the people that support Trump, most of them got money. Most of them have. Enjoy your conversation. I have to get back to work. Have a good day. Okay, Queen Dopest, I love you. Uh, and make sure Queen Dopest has a YouTube page as well. Make sure y'all go check out Queen Dopest. Subscribe to her YouTube. Um, Most of the people that support Trump have health insurance. They got primary care physicians. They got testing kits available in their areas. Again, back to the topic is COVID and colored people. Like we just saw, it's been on full display in here. You got some that believe if they gonna get it, they gonna get it. Which it's hard because you dealing with, they might not care about them, but does it mean that they don't care about others around them? Because if you're not wearing a mask, if you're not social distancing, are you helping create them? Does anybody feel a responsibility for that? I just think, man, the majority, and especially right now in this time that we in, the focus is shifted anyway. You know what I mean? With the Black Lives Matter movements and all the different movements that's going on right now, really. For people to be treated as humans, they have kind of, in the black community, Latino, and they kind of shifting away from really like focusing on focus on COVID. From what I saw, it's like I said, it's crazy. I went to this thing and a lot of people had masks, but most of them ended up taking them off. Hugging one another, and like I said, you can't stop the spread of this virus like that. It's not gonna work. If I'm in a room and 500 people got masks on and 500 people don't, then everybody might as well not have a mask on, right? Because the mask doesn't protect you; it protects others, right? So people not even gonna do that. People not even gonna do that. Mm. I had to spark my doobie on that. I don't know. It could be overwhelming. I think. I think it'd be overwhelming to even think about it. So many. Look, we fighting for equal rights and equality, but we don't have equal rights and equality. So obviously, it's gonna affect us when it comes to health care and resources. It's just no way around it. Let me read y'all this thing. Hold on, from the CDC I checked out. Mm-mm. All right. Non Hispanic American Indians or Alaska Native persons have a rate approximately 5 times that of non Hispanic white persons. So that means that uh, all the people from native to Alaska and the Native Americans have a rate approximately 5 times that of white people. Blacks have a rate approximately 5 times that of white people. Latinos have a rate that is 4 times that of Hispanics and non-whites. Y'all not that's we talking about the numbers. When we talking about the numbers that we talking about, that's a lot. That's a lot. So for every one white person that gets it, 5 black people getting it. Shit. Man, make it make sense. Make it make sense. What? For every white person that gets it, 4 Latinos or Hispanics will get COVID. For every one white person that gets it, 5 black people will get it. 5 Native American or Native Alaskans will get it. Them is big numbers, man. Cause let me go to CNN real quick. Let me go to CNN real quick. We gonna see. Cause they keep their numbers up there, which we're relying on other people's numbers because African Americans, African Americans, we don't have our own news networks that are broadcast nationally. So let's look at the numbers. So we got almost 3 million cases in the United States. Almost 3 million. So do the math. If you got 3 million and only 1 out of every 4 or 5 of that 3 million is whites, you know how big that number is? I mean, I'm no mathematician, but I can get somebody to come in here and put together a formula, an equation to figure it out. I just know it's a big ass number. That's a big ass number. If it's 3 million cases in the United States, that's not deaths, that's cases. So and varying degrees, right? You have some people that have mild case. It's just like the flu. Somebody get the flu, you might have that shit one day. 24-hour flu. You know what I mean? Then you got others that should knock you down for a whole week or two. But do you know how big that number is? So although it hasn't affected you yet, it's bound to affect you. I don't know. To me, it's gonna be points in time where you're gonna have to take that risk, and you're gonna have to, put yourself at risk when dealing with people. You're gonna have to deal with people at some point. It's funny. Everybody is being told to do shit we supposed to been taught and been doing since we were children, and wash our fucking hands. And I'm the worst when it comes to keeping my hands out of my face. I'm always rubbing my eyes. I'm always doing this. I'm horrible. You know what I mean? I'm horrible when it comes to like touching my. So I went out the first time I left the house after they did the lockdown. Um, I can't remember if I had a. I did have a mask on. So I go in the store. I purchased my items, and I think I had to use the um, the card reader. Use my credit card. So I used that. And I'm looking at the lady done touched the whatever I purchased. So I grabbed that. So I got in the car, and I didn't at the time. I don't think I had my hand sanitizer in the car, or if I did, I didn't use it. But I was so ready to take that damn H90 whatever off. I took it off, and the first thing I did because it makes you hot, and I had like little sweat around my nose. The first thing I did was go like this, and I panicked the hell out. I panicked the hell out. That little 3-minute drive from the store back to the house was so excruciating, and because I really did like panic. Like, no shit. I said, fuck, I touched my face. You know what I'm saying? I was like, fuck, I done touched my face. It's scary times where, one mistake. And then I understand the argument that you can't live in fear of this shit. We got to keep living. Like I said, I ain't even so much concerned about myself. I'm concerned about others around me. You know what I mean? Because you're not going to know if you get it, who you got it from, really, unless you have stayed in the house and only had contact with one person. You're not going to know who it was. You just going to know you got that shit. They keep trying to trace everything back. That's the funny thing. They got those people that were in the club and the police subpoenaed the people because they want to trace back. I don't understand how they doing all that. That's a whole nother level of science and mathematics skills. That's way above my pay grade. You know what I mean? But if they gonna open you got, even with the numbers increasing, you got states that are moving forward with their reopening plans. You know what I mean? They still moving forward with the reopening of their cities and communities. So I don't know. I just know according to the numbers and according to the way that non-white ethnic groups live, because like I said, a lot of blacks, we got live in apartments. Um, a lot of blacks aren't homeowners around the country. There are certain places where blacks own more homes, but for the most part, blacks live in densely populated areas. Latinos live in densely populated areas. Latinos live in big family homes, like as far as like how many people live in the homes, because they're close family units. Uh, that plays a huge factor. If you live in a quote unquote projects, and again, let's go back to the fucking name, it's called projects. So if they are infecting people, where's to me, the first places it's gonna be the projects. Because that's where they know they got one group of people they can watch, they can monitor. So it's gonna affect, you know, non-whites more. Go look at where most white people live. It's spread out. They normally live in houses where they gotta wave to the neighbor down the road, you know what I mean, or down the street. Hey, how you doing? A lot of projects, you open the door, you might open the door same time your neighbor open the door, and y'all motherfuckers is face to face. Y'all face to face. Mm-hmm. All I can tell y'all, man, is to sum this all up is be prepared. Be prepared. A lot of times they give us the warning signs. They give us the information. It's out there. Katrina, a lot of these other uh things that really affected our communities. A lot of times we don't want to listen. I'm gonna just keep it real. We don't want to listen until it affects us, until it really hits us. So if it is their master plan to infect us and with this virus and it deplete our numbers, because the crazy thing is we fighting for social justice, and primarily that has to do with the criminal justice system and the police, a policing of people. um these it causes us to get together. It causes us to come together, which helps. If that's what people believe is their plan, then I don't. It seems like we playing into their plan, then, right? That's how it seemed to me. You know, but I mean, what can you do? It's the time is now. The movement is real, so people got to keep fighting the fight. I'm just hoping that it ain't at the detriment of our numbers, because we fighting for social injustice. That's one way they depleted our numbers, by putting so many people of color behind bars. So while we fighting to get them out, they depleting our numbers another way through this virus. You understand what I'm saying? Because you finally got a lot of I mean, you got a lot of whites and others that are fighting the fight now. Like if you watch the protests, it's a lot of non-blacks, non-Latinos, Asians, Middle Eastern. It's a lot of those out there fighting alongside. So their eyes is open to that part, right? But while we fighting for the criminal justice and the policing uh, and civil rights, 1 in 5 of for every one white person that's getting COVID, it's 5 blacks, it's 4 Latinos, it's 5 Native Americans. Think about that though. That's bananas. So you don't think they'll give up one of their own to take down 5 of us? 4 Latinos? Mm, think about that. Yeah, think about that. Make sure you guys share this stream for me. This is only episode 2, so every time I go live on here, man, if y'all know me, it's gonna get bigger and better. We're gonna add some more things to the game. I need y'all to jump in the comments once this video is uploaded and tell me what y'all want to discuss next for tomorrow morning or the morning after. I would like to do this every morning. We're gonna see how that goes. But I appreciate all the support all the time. Y'all know what it is. It's one love and nothing on mine. Your stream is watching, man, tell them come subscribe. Dopest TV on YouTube. Go check out my Instagram, The King Dopest. Also check us out on the number one, lovefam.com. so you can check out what we about. But I'll be back on here tomorrow morning. Man, we went over an hour. It was good. Hopefully, tomorrow y'all get on here and jump right in. So we whatever we talking about, we can get right to it. I love you guys. Nobody else told you you have value, worth, importance, and you mean something. You're smart, a mover, a shaker. King Dopest said it, and my One Love family said it. And I'll see y'all next time. All right, one love.